in our neck of the woods, the developmental history plays an important role. Like developmental is how did you start, how did you get through adolescence, and so on. What it tells us, and there's a technique called the life review. So we go through the history saying, okay, well, did you have abuse? Did you have neglect? You know, because childhood adverse events naturally affect, you know, whether you're going to have depressions and so on. But one of the things we focus in on is coping mechanisms throughout their life. So when you could talk about catering it to the patient, you have to see, you know, there's certain ways that, you know, there's patients that cope by playing sports. There are certain patients that cope by listening to music. Unfortunately, certain patients use substances or alcohol to cope. So as you listen to their life review, you can use these kind of sentinel events and sentinel ways that they overcame things to say, you know what, you have the skills to move forward with skills that you had previously. And so that's a kind of a big reminder we try to tell patients is, you have changed, but you haven't changed totally. And so it's an analogy I like is, you know, you have a wheel and you remove some of the spokes, the wheel still turns, but you have to get used to the new wheel. And if you can move towards accepting that, as opposed to constantly comparing, oh, I can't be like I was before, or I'll never get to where I want to, that is depressing to keep that going. So you have to focus in on what you have, and that's where concepts like mindfulness, here and now, and moving that wheel without the spokes that you may not get back.